Greetings, everyone. Today we're going to be talking about substance use problems, the causes, the signs, the symptoms, and then interventions for those who are experiencing them. I am Dr. Mark Hurst. I'm the medical consultant to the Ohio Substance Use Disorder Center of Excellence at Case Western Reserve University, and I will be your presenter today. First, a bit about us. The Ohio Substance Use Disorder Center of Excellence, or SUDCOE, is committed to addressing addiction through high-quality training and implementation of evidence-informed models. The SUDCOE is supported by the Ohio Department of Behavioral Health in collaboration with the Center for Evidence-Based Practices and the Began Center for Violence Prevention, Research, and Education at Case Western Reserve University. The SUDCOE provides Ohio's community treatment network with essential evidence-informed technical assistance. Our focus is on building a highly skilled workforce that can navigate the complexities of substance use, mental health, and primary care integration, ensuring positive outcomes for all Ohioans. Today we're going to discuss a few general things about addiction, or substance use disorders as they're now called, including the basics of potentially addictive drugs, what increases the chances of a person developing a substance use problem, what the signs and symptoms of substance use disorders are, and finally, where people can get help. Okay, so let's get into talking about this a little bit. The first question you might have is, how common are the use of different substances in the United States? Well, the clear winner is alcohol. About half of the adult population drinks alcohol. Number two would be tobacco products, where we have about 48 million Americans who use them, and then marijuana is only slightly behind that with 44.3 million. Chances are throughout your life you've heard a number of different terms that are used to refer to substance use problems. Substance abuse, substance dependence, substance misuse, chemical dependency, addiction, addictive disorders, addictive personality, alcoholism, alcohol abuse, problem drinking, and the list goes on, including some terms which are not at all complementary. So those are the commonly used terms for people who might have substance use problems. But the preferred term in 2025 is substance use disorder, or SUD. And that term was chosen because it doesn't have a lot of the negative associations that those terms on the previous slide have. The substance use disorders have specific criteria for diagnosis, and those criteria weren't just picked out of thin air. They're shown to be reliable based upon studies and evaluation of thousands and thousands of individuals. They can be found in what's called DSM-5, you may have heard of that, which is the Diagnostic and Statistical Manual of the American Psychiatric Association. And it has criteria not only for diagnosis of substance use problems, but also depression and anxiety and a number of other things. There are a number of drugs that are associated with substance use disorders. Alcohol, tobacco, and cannabis are clearly the top three. Opioids, although they are not used nearly as frequently, are associated with a very high mortality rate and probably have resulted in the death of 1 million or more people in the United States in our recent crisis. Stimulants like cocaine, sedatives like Valium, Xanax, Klonopin, and then there are a number of others which we won't be mentioning today. All those drugs and any other drugs that can cause addiction have certain things in common. All of them work on and imitate our naturally occurring brain chemistry. And specifically, all of them increase, either directly or indirectly, the activity of dopamine in our brain reward centers. That dopamine is released and those same brain reward centers are activated when we do natural things that are enjoyable. Things like eating, drinking, and sex. By now you're probably feeling like you're back in high school biology, but I promise there won't be too much of this. But all of these drugs work on our brain, and the brain has certain specialized functions in different areas. The one we're going to be most interested in today is the reward center, which is right here with projections back and forth. It's called the nucleus accumbens in the ventral tegmental area. I swear there won't be a test after all of this, but it's important to know that there is a specific area that's associated with the experiencing of pleasure, reward, and reinforcing effects. This is what a typical dopamine neuron or nerve cell is like. So there's dopamine in these things called storage granules in this neuron. And then when it becomes activated, the dopamine is released and acts on these things that are called receptors in yet another neuron. So what does all this have to do with drugs? Well, as I mentioned earlier, the drugs bind these reward centers. So if we take a drug like cocaine, which I think all of us would agree is an addictive drug, it has uptake in those two areas, which is one of the things that tells us that cocaine is an addictive drug. Now, specifically, when cocaine is introduced into the system, it does some binding, but the end result is that you end up with a lot more dopamine in this area, and it has a lot more effect on the brain cells that it impacts. So to go back a little bit, here is the dopamine cell without cocaine, and here it is with cocaine. So you can see there is a lot of more dopamine that's released at that point, so we get a lot more effect than we do from naturally occurring things. Opioids, which there has been a lot of issue with, specifically in the 21st century, also has uptake in those two areas, which tells us that this also is an addictive drug. It works a little bit differently. It binds the opioid receptor and then has a secondary effect of releasing dopamine. But if we go back again, no opioid present, we see that there is a lot more dopamine that's being released, and again, more than natural activities can do. Well, since we are talking to cannabis dispensaries here today, let's talk a little bit about THC, which, as you know, is the main psychoactive component found in marijuana. And it, too, has binding in these biological reward centers. THC also promotes the release of dopamine. It binds the THC receptor. We do have naturally occurring cannabinoid receptors, or THC receptors, and then causes the release of more dopamine than would occur naturally. So to look at this one more time, here is normal functioning of a neuron that contains dopamine, and here it is with THC. So again, a lot more dopamine is found here, promoting its reinforcing effects. So you might say, well, okay, great. These drugs increase dopamine. What does that really do? Well, the release of dopamine that's caused by addictive drugs in those brain reward center is much greater, and the high is much more intense than what we experience naturally. And the natural things that we talked about earlier that lead to increased dopamine release, like eating, drinking, and sex, all of those are important for our survival. So basically, these drugs trick us into thinking that they're needed for survival, and then they create the urge to do them again and again, even if it's destructive in the end. But it's really, really important for us to point out that not everybody who uses a drug develops a substance use disorder. It's not just about using a drug. In fact, more people who use drugs do not have a substance use disorder than do have a substance use disorder. What it's about is how does the brain respond to that drug, and then what kind of behaviors occur as a result of that. And some of those behaviors include things like an inability to control use. They just can't stop when they want to stop. Craving for the drug, or continuing to use it even though it's causing problems. That said, substance use disorders are still pretty common. So about 1 in 7 people, 14% of the U.S. population will have a substance use disorder sometime during their life. And although that doesn't seem like a high percentage, we know the results can be devastating, not only to them, but to other people who are indirectly or directly affected by their substance use disorder. And about half of U.S. adults are directly or indirectly affected. Almost everybody knows someone who has a substance use disorder. And importantly, substance use disorders are treatable, and people with substance use disorders can and do recover. So we have this situation where most people who use substances don't develop a substance use disorder, but some do. So what's the difference? What happens that one person will develop a substance use disorder and another won't? Well, it kind of gets down to what you bring into the world and what you experience in the world. About half of the risk seems to relate to genetics or inheritance. If you have a mother or a father or a brother or a sister who has a substance use disorder, that gives you about a 50-50 chance of having one yourself, which is much higher than the overall risk in the population, which is about 10 to 15%. And then what you experience in life comes into it. Obviously, one of those things is exposure to potentially addictive substances. If you're never exposed to addictive substances, you're not going to develop a substance use disorder. But if you are, the potential's there. That's especially true if that exposure occurs early in life, which is associated with a significantly increased risk. And that's true for all substances. The earlier in life someone is exposed to a substance, the more likely it is that down the road they develop a substance use disorder. Childhood trauma, like abuse and neglect and other forms of trauma, also increased risk, and substantial life stress itself at any point in life will increase risk. Having another substance use disorder increases risk also, because substance use disorders tend to travel together. So if a person has one substance use disorder, the likelihood increases that they either have or eventually will develop another substance use disorder. Be it opioids and alcohol, stimulants and sedatives, cannabis and stimulants, it's common for any of those to occur at the same time. Having a mental illness increases your chances substantially as well. About half of people who have a severe mental illness also have a substance-related problem, which again is much higher than the 10 to 15% that's found in the general population. And finally, the characteristics of the drug itself. Those drugs that are associated with more rapid onset of dopamine release and higher levels of dopamine release result in a faster and more intense high, and they are associated with an increased risk of a substance use disorder. So how do we define substance use disorders or addiction? So this is a definition from the American Society of Addiction Medicine. Addiction is a treatable, chronic medical disease involving complex interactions among brain circuits, genetics, the environment, and an individual's life experiences, just like we've talked about previously. People with addiction use substances or engage in behaviors that become compulsive and often continue despite harmful consequences. Before we get into the specific signs and symptoms of substance use disorder, let's talk about what they are and what they aren't. So what they are, as was indicated in the previous definition, they're chronic brain disorders which are due to a combination of genetics, life experience, and stresses. They're also diseases that can be effectively treated with talk therapy, with medication, or with both, which restore life functioning and help the brain and body to heal. What they are not problems of morality. They are not due to weak will, and they are not due to primary personality problems. So, it is not uncommon that people behave in ways that are not typical of them when they have a substance use disorder. That's not the primary problem. That's a result of the substance use disorder itself, and those things tend to go away once a person gets into recovery. And there's certain things that you're not going to find as part of a substance use disorder diagnosis. Whether it's legal or whether it's illegal, and we all can cite examples of that, right? Alcohol is certainly a legal substance, and many people develop alcohol use disorder. Again, about 14-15% of the population. And whether it has medical uses. So opioids clearly have medical use for the treatment of severe pain, yet they also can be addictive. So those are not part of a substance use disorder diagnosis. Okay, so we've talked a little bit about why substance use disorders occur, where they occur, what things are associated with an increased risk of them. Now let's get down to the nitty gritty and start talking about the symptoms of a substance use disorder or how they present. So there are basically within DSM-5 that we mentioned earlier, 4 broad categories: impaired control over use, social impairment related to use, risky use, and physical or psychological problems related to use. If you have 2 or 3 of those 11 symptoms, it's considered a mild substance use disorder, 4 or 5, a moderate substance use disorder, and 6 or more, a severe substance use disorder. I would like to point out that for virtually all substance use disorders, the most frequent degree of severity is mild, a little bit over half. And whether we're talking about alcohol or whether we're talking about cannabis or whether we're talking about other drugs, most people would be considered as having mild substance use disorder. That's not to minimize it, because mild substance use disorders can still be problematic and still can create substantial difficulties in the life of the individual and in the life of those that are associated with them. Let's start talking about specific symptoms of substance use disorders. These apply to all substances. So whether we're talking alcohol, stimulants, cannabis, opioids, whatever substance we're talking about, these symptoms are the same. So let me explain a little bit about how these slides are set up, because the next several will be set up the same way. So in the red box here at the beginning, these are the actual DSM-5 words about a specific symptom. The next one are questions that might be asked to see if a person has those kind of symptoms. And then the final one is the kind of responses that might be given when those questions are asked, or sometimes people just say it spontaneously. So the first symptom, which fits under that inability to control use, is that the symptom is taken in larger amounts or over longer duration than intended. So a question that might correspond to that is, how often do you find you can't quit when you start using? And somebody may say, there are times I try to limit how much I use, but it seems like once I start, I can't stop. And that's really that inability to control use. And beyond that, it's less an inability to control use than it is an inability to predict the control of use. A person who does not have a substance use problem should be able to stop at any time he or she wants to do so. I'm going to have 2 drinks, I'm going to leave at 5 o'clock, but every time they intend to do that, they should be able to. It may well be a person with a substance use disorder can do that sometimes, but if they can't do it every time, if they can't predict when they can and cannot do it, they do have that inability to predict the control of use. The next symptom is persistent desire or unsuccessful attempts to cut down or to control use. So a question that might correspond to that is, how often do you feel like you should cut down or quit? And have you ever tried? And a person may say, I feel like I need to quit, but it seems like every time I try, I end up going back to it. And that's pretty typical of a person who has a substance use disorder. They intend to quit, they try to quit, but they're unsuccessful. People who don't have substance use disorders usually can quit and can do so persistently. The next symptom, a great deal of time is spent in efforts obtaining the substance, using it, or recovering from its effects. So a question might be, how much time do you spend getting, using, or recovering from alcohol or drug use? How often do you think about using? So this is really kind of a preoccupation question. How much is it on your mind? It says, well, it seems to me that this drug's on my mind almost all the time. I'm either high, coming down, or looking forward to the next time I can get high. Again, a preoccupation with use. It's always on the mind. It's always part of the activity. The next symptom would be craving or a strong desire to use the substance. And a question could just be straight up, do you ever crave alcohol or drugs? And a person may say, sometimes I want to use so badly that I just can't resist no matter how hard I try. So really what happens with this is the drug craving is like a biological urge. It's not just, I'd like to have a drink to unwind. It is, I feel like I need to have this. Just like we need food, just like we need water, a person will feel that they need substances in that same vein. And that's because of that dopamine kind of activation that we talked about previously here. So craving is a really important symptom of a substance use disorder. Next symptom, recurrent use results in a failure to meet major role obligations at work, at school, or at home. So a question that goes with that might be, how often do you not do what is expected of you because you're using? And a person may say a lot of things to this, but an example might be, the other day I forgot to pick up my kids because I was getting high and lost track of time. And of course, there are lots of other examples for that too. Not being fully available and functioning at work, or calling off work, or not being able to do schoolwork, or not showing up at school. All of those would fit that inability to meet the role obligations. Continued use despite social or interpersonal problems due to use. So questions that go with that might be, having any problems with family or friends? What about your employer? Do they say it's because of your use? Well, my boss said that if I have one more positive drug screen, I'm out. If I lose my job, then my girlfriend says that she's gone. So people who don't have a substance use disorder, if they're told that if they continue to use, that they're going to lose something that's important to them, most people would stop using at that point. However, the person who has a substance use disorder may try, but just is unsuccessful in doing so. Giving up or reducing important social, occupational, or recreational activities due to use. So, are you doing less things than you used to do? Things like missing work or school, spending less time with friends or family, or giving up hobbies? And you might hear something like, well, I had perfect attendance at school when I was younger, but not anymore. I'd rather just get high with my friends. So really what you see with this, particularly as a substance use disorder progresses, is that the substance use gets bigger and bigger, and the rest of life starts getting smaller and smaller. Let me give you an example. A young man that I saw quite a while ago who had alcohol problems. And when he was in high school, he did well in school, he was on the golf team, he had a job, and he drank. Well, as time went on, each of those kind of dropped out bit by bit. His grades started to go downhill, but he still was on the golf team and he still worked, and he drank. And then as time went on, he quit the golf team. So he wasn't doing as well in school, was not playing golf, and he worked, and he drank. And as time went on, he's continued to do poorly in school, not on the golf team, quit his job, and he drank. So life became smaller and smaller, and alcohol started to take up more and more of his life. It's not uncommon to see that in a person who has a substance use disorder. Recurrent use when physically hazardous, and I think this is pretty much self-explanatory. So how often do you use when it could be hazardous? Things like driving, taking care of children, or using machinery. Yeah, I use when I'm driving. Don't you smell it when cars pass you? It's not a big deal. Well, yes, in fact, I do smell it when cars pass me. And it is a big deal because there is motor impairment and there's also cognitive impairment that's associated with using substances, and they should not be used when physically hazardous. It places both the individual who is using as well as those around them in jeopardy. Continuing to use despite knowing the substance is causing physical or psychological problems. So a question might be, has the doctor ever told you that you're having health problems due to using alcohol or drugs? And a person may say something like, well, I went to the doctor because my stomach hurts all the time and I vomit a lot. She said it was cannabis hyperemesis syndrome and I needed to quit. Sounds like it's made up to me. Quit? No way. So if a person is diagnosed with a physical problem, and it relates to their substance use, and they continue to use, that's something that is suggestive of them having a substance use disorder. Continued use despite knowing that the substance is causing physical or psychological problems. So, how often do you get paranoid or anxious when using? Well, I was at a concert smoking weed and I felt like I needed to get away from everyone. It was like a panic attack. It happened again at the next concert and then the next one too. So there may well be a relationship between the smoking weed and the panic attack. It could also be being around the crowd, or it could be a combination of the two. Now, this can vary from substance to substance, what kind of psychological symptoms might be seen. But if there's a relationship between the two and a person continues to use, that would certainly be consistent with one of the symptoms of a substance use disorder. Tolerance, or needing more and more to have an effect from a substance. So, how much does it take to get high compared to the past? Well, the weed's a lot less potent than it used to be. I need to use a lot more to get high than when I was younger. Well, in fact, the weed is not a lot less potent than it used to be. In fact, it's more potent than it used to be. So if a person is requiring more in order to get high, it's not because the weed is less potent. It's because they've developed tolerance and need higher doses in order to get the same effect from it. And then finally, withdrawal. And the symptoms of withdrawal are specific to different substances. For example, with sedative withdrawal, a person will feel hyper-aroused. Their heart rate will go up, they'll have high blood pressure, they'll sweat, they'll feel anxious and shaky. On the other hand, if a person has tolerance to stimulants, it's going to be exactly the opposite. They're going to want to sleep all the time, they're going to want to eat all the time, and they're not going to have any energy. So it really varies from substance to substance. But for cannabis, we're really talking about three major things: headaches, trouble sleeping, and feeling nauseated. So do you ever get headaches, have trouble sleeping, or feel nauseated when you haven't used for a while? If you do use, do those symptoms go away? I have trouble sleeping unless I smoke weed at night. So a person may well be having trouble sleeping or insomnia as a result of a cannabis withdrawal with that. If the symptoms go away, it's even more likely that they have tolerance and they're experiencing withdrawal symptoms. Now, before we finish up, just a few things about marijuana. As mentioned earlier, marijuana is the third most used psychoactive drug in the U.S. 22.3% of Americans over the age of 12 used in the past year, which amounts to about 64 million people. 15.4% over the age of 12 used in the past month, and 3.5% use every day. The highest rates of use are those in their late teens to mid-20s, 18 to 25, where about 35% do. The group where it's increasing the fastest is in those over the age of 25. So it's just a little bit of demographic information. There's also an association between frequency of marijuana use and the likelihood of developing a cannabis use disorder. When you look at people who use annually, the rate's about 3.5%. But if you increase that to monthly, it essentially doubles from 3.5% up to 8%. And then if you go to weekly users, it essentially doubles again from 8% to 16.8%. And then if you go up to daily users, it doubles again to about 36%. Now the other side of the coin is that even among daily users, about 64% do not have a cannabis use disorder. But 36% is still a pretty significant number. And those 36% can experience all of the negative outcomes associated with a substance use disorder, and those results can also impact their family, their friends, their coworkers, and others secondarily. And I do want to indicate again, the diagnosis of cannabis use disorder or any other substance use disorder doesn't have anything to do with whether it's legal or not, or whether it has medical uses or not. It's diagnosed using the established criteria from DSM-5R. Like all other substance use disorders, it's treatable. Cannabis use disorder has established and effective treatments that can help a person to a better and healthier life and recovery. Now, I'm not going to go through all of those today, Just know that they do exist, they have been studied well, and they can be very helpful. So you've been through all of this, and you find that someone may need treatment or at least might need further assessment. Where can you turn? First, it's important to know that effective treatments are available. And fortunately, there are some good resources to help direct a person. The best place in Ohio to identify local resources is through the local Alcohol, Drug Addiction, and Mental Health Board, also called the ADAM Board. The website on this slide has links to all of the ADAM boards for each county, and their web pages generally list the local treatment resources. Another place to go is also listed on this page, and that's findtreatment.gov. That site's operated by the federal government and has an interactive tool where you can enter what kind of issues are involved, what a person's zip code is, what insurance there is, and even other information that'll help you sort out treatment that would be appropriate. So both of these are really good sites for locating treatment, and I suggest you keep them handy. Okay, bringing it home now. What are the final take-home points today? Well, first, most people in the U.S. have used a drug that can cause a substance use disorder or addiction. Some, but not all, will develop a substance use disorder. And alcohol use disorder, tobacco use disorder, and cannabis use disorder are the most common substance use disorders in the U.S. Going on with the take-home points, where do they come from? Substance use disorders are a combination of genetic factors, environment, and life experiences, what you brought into the world and what you experience in the world. And they're diagnosed using established and tested diagnostic criteria, and those diagnostic criteria can also be called signs and symptoms. Those criteria are well established from the DSM-5. The hallmark symptoms are inability to control use or inability to predict control of use, as I mentioned earlier, compulsive use, using again and again and being unable to stop, cravings, and continuing to use even though the use is starting to cause life problems. Other symptoms include things like giving up important life activities due to use, being preoccupied with use, being unsuccessful in cutting down or quitting, having tolerance, and having withdrawal. But perhaps most importantly, treatment is available for substance use disorders, and it's effective. So it helps a lot of people restore their lives that were damaged by addiction, and it is of benefit to them, their families, and their communities. Thank you for participating in this training today. It isn't your job to sort through all the diagnostic criteria with your customers and decide whether they have a substance use disorder or not. Only people who have the appropriate license or certification should do that. But now that you're aware of the different signs and symptoms, hopefully you can recognize some of the warning signs and concerning behaviors that occur in people with SUDs and can suggest where they can look for help. I hope this information will be of help to you, both as you interact with your customers and as you go through life. Thank you very much.